Celebrating life with Down syndrome and Pastoral seatbelt, a class goes on Down syndrome for brothers and sisters. He is a graduate of Duke University, Harvard Medical School, and Harvard Kennedy School, and he is currently an associate professor, Harvard Medical School. Dr. Skotko is a renowned clinical and translational researcher about Down syndrome. He has been featured in the Wall Street Journal, the New York Times, the Washington Post, the LA Times, and NPR Point, and ABC's New Morning America. Dr. Skotko serves on the honorary board of directors for the Constituents Down Syndrome Congress. Thank you.
Thank you so much for that wonderful introduction. It is so great to be back for the second conference. In many ways, it feels like coming home. This is my third trip to India with my wife and my first trip to Pune. So thank you so much for welcoming back, for your love. It's so great, the family community that you have here, and I look forward to learning with you throughout today. As you heard, I am lucky enough to be a physician at Massachusetts General Hospital, where I direct a clinic where we see about 400 to 500 patients with Down syndrome every year. And this morning they asked me to share with you some of the medical issues that come up with children and adolescents. I'm going to try to get through the information and reserve a little time at the end for your questions and answers. But the biggest role I play is I'm a sibling. So I have a sister with Down syndrome, and she's to thank. So let us begin. We're going to talk all about medical care and healthcare information. And again, at the end, I'll reserve some space to take questions. I want to say that medicine is as much a science as it is an art. And the way one practices medicine in one part of the world doesn't mean that that's the only way to practice medicine. I'm going to share with you how we practice medicine for people with Down syndrome in the United States, and it's based on the American Academy of Pediatrics guidelines here. If you would like to get a copy of these guidelines, if you go to healthychildren.org, you can find the age group of your son or daughter with Down syndrome. For example, here you can see that this is the guidelines for ages 1 to 5, and you're able to download these recommendations so you can take them to the doctor for your son or daughter with Down syndrome, and in the checklist fashion, you can get all the items done that are needed to be done based on that age group. So this is where you can get it all for you and make sure you can take it to your doctor. And throughout the talk, my information is going to be up to date with these recommendations. I want to start with the number one issue that I hear when people come to clinic. My son or daughter is having some behavioral issues. Sometimes people with Down syndrome are not angels all the time. So what do those behavioral issues mean? Sometimes they can be the only clue that there are medical issues going on. Sometimes when people with Down syndrome start to lose their hearing, that becomes confusing and they start to act out in new behavioral issues. Regardless, up to 3 out of every 4 people with Down syndrome will have some hearing loss. And we know that you need to hear in order to speak clearly. So it's really important that everyone with Down syndrome gets a hearing test every year for the rest of their lives. And that's because they can have conductive hearing loss, or something is getting in the way and we need to clean it out or make sure ear tubes are in place. Sometimes it can be sensory neural hearing loss, where the nerves are not working correctly, so we need to make sure that we have hearing aids or we have an amplification system in place, or it could be a combination of both of those. So again, every year you want to make sure your son or daughter with Down syndrome has a really good hearing test to make sure that they're hearing properly. Sometimes people with Down syndrome start to have some vision loss. When the world becomes blurry, you can act out with some behavioral issues. So we know that people with Down syndrome oftentimes will need to wear glasses. Sometimes their eyes will have a little bit of shake and they need to work with an ophthalmology or an eye doctor to see if there's other issues going on. Sometimes the eye muscles need to be strengthened, and that can be done with some patching or some surgery. Sometimes there are cataracts or some non-clarity of the lens that we need to check in, and sometimes the tear duct isn't always open. All of these things are so easily addressable. We want to make sure they don't get in the way because we want our sons and daughters with Down syndrome to see well so that they can learn well, right? Thyroid issues. So thyroid is the gland that's in your neck, and this is off in about 15% of people with Down syndrome. The reason why we want to check is it's so easy to correct. If someone with Down syndrome has too little thyroid, they can start to feel tired, sluggish, have constipation, or feel cold. If they have too much thyroid going on, they can be hyperactive, restless, have diarrhea, sweating, or behavioral issues. And since everyone with Down syndrome almost has one of those symptoms every single day of their lives, the point is, how often do we check for thyroid? It's important every year for the rest of their lives that the doctor checks for thyroid in their blood. And so as a mom and dad, you want to make sure that you know your child's two values every year. One is TSH. TSH is the signal from the brain that comes down and tells the thyroid gland, represented in the green pentagon here, to produce what's known as free T4 or FT4. So in the blood, you want to measure your son or daughter's TSH and free T4. And depending upon whether they're up or down, the doctor can make a determination whether or not they have too little or too much. For example, if the thyroid gland is producing too little, the signal from the brain comes up and it says, produce more, produce more. If we're in this category here, this is too little thyroid. That's much better. In this category, if the thyroid level is up, the brain says, slow down. And this is known as hyperthyroidism, or too much thyroid. Sometimes we're in this pattern here where the thyroid is producing the right amount, but the signal from the brain is way too big. In this particular case, which we see in people with Down syndrome, we sometimes start to treat with medication. So we want to make sure our son or daughter is in any of these categories. If they are, we know how to easily treat them with medicine or sometimes with surgery if needed. You want to work with your doctor or sometimes a hormone doctor, which is called an endocrinologist. People with Down syndrome start to have behavioral problems when their stomach doesn't feel well. And we know that up to 5% of people with Down syndrome could have celiac disease, which is where the body starts to react to the inside lining of your intestines when certain foods are eaten. And typically these are foods that contain gluten, which include barley, rye, and wheat. The symptoms are any sort of GI issues such as diarrhea, constipation, bloating, etc. You start with a blood screen. If that screen is positive, then we need to work with a doctor to get an intestinal biopsy. If that shows that there is celiac disease, we want to make sure we modify the diet so that the diet doesn't contain the food that activates the immune system inappropriately. I want to take a little aside. Those of you who want more information on anything that I'm talking about, if you go to my former hospital, childrenshospital.org/Down syndrome, to honor the late Dr. Alan Crocker, who was a leader in the Down syndrome movement, we created a series called the Speaker Series. If you click there, there's about 40 different free webinars for moms and dads, where you can watch any topic you want. There's a topic on thyroid and Down syndrome, toilet training and Down syndrome, celiac and Down syndrome, sleep apnea and Down syndrome. So if your son or daughter has any new medical issue and you want more quality information for free, this is where you could go. And this is what it looks like. This is a show on celiac and Down syndrome. You see a doctor talking up here, and the slides will advance explaining it so that you can understand it. Again, available from your home computers. But let's go on. We're now doing the workup for behavioral issues. We thought about hearing, we thought about eyesight, we thought about thyroid, we thought about celiac. The next thing we need to think about is constipation. People with Down syndrome are constipated until proven otherwise. So many of my patients have so much stool. This is a patient of mine that was being kicked out of school. She's 8 years old and the school said that it's absolutely intolerable. Her behaviors are a wreck. They cannot, under any circumstance, get her to behave and pay attention. The mother was crying. She said, what am I supposed to do? Why can't she behave well? So we got an x-ray, and as you can see, in an x-ray, white is bone. So here is the spine. Here are the ribs. Anything that's black is hair. So here's your lungs up here, which are black. Your colon, or your large intestine, if it has nothing in there, should be black, like your lungs. If it has stool in there, it's going to be white. So your colon kind of looks like this. Here's a big stool ball, big stool ball. This is packed with stool. This is all speculated stool. We found out her entire abdomen was full of stool. And this is a mom who thought that her daughter was having a regular bowel movement. This hurts. And it hurts so bad she can't contain her behaviors because she's always feeling crummy everywhere, all right? So then we gave her a makeover. And this is what she looks like. Isn't she beautiful? Look at how beautiful she is. So all this stool here is now gone. All of this impacted stool, you now see air balls, air balls, air balls all the way down. We cleaned her entire colon out. We sent her back to school. And within 2 days, the teacher wrote. And we didn't tell the teacher what we did. And the teacher said, oh, it's a miracle. She said, what psychiatric medication did you finally put her on? And we wrote back and we said, we didn't. We just put her on a bowel medication, right? So people with Down syndrome, like my sister, need some help going to the bathroom, and that's okay because it makes them feel better. And you can either bulk it up, you can soften down the stool, you can slide it out, you can squeeze it out, or you can water it down. There's lots of ways to get stool out, and I would work with your son or daughter's doctor to make sure it's getting out. They shouldn't strain, and we want everyone to have a regular bowel movement every day. This is a parent who sent me a photo before coming to my clinic and said, my son is just having all these behavioral issues, crying during the day, can't regulate during the day. I'm doing everything possible, what am I doing wrong, right? And this was wonderful because we know what this child has already. Do you see it? It's there in the photo. This child has a very serious condition. If we zoom in, this is someone who has whopping tonsils, right? So this is someone, when they're sleeping, there's no room for oxygen to get in there, and up to 75% of children with Down syndrome develop obstructive sleep apnea. If your son or daughter answers yes to any of these questions, do they snore at night? Do they fall asleep during the day? Do they need to take naps? Do they not seem refreshed during the day? Are they yawning? This is a big concern for obstructive sleep apnea. But here's the challenge. Even if they answer no to this, the majority of obstructive sleep apnea is silent. It gives us no clues whatsoever that it's going on. And this is the reason in the United States, everyone with Down syndrome gets a test for sleep apnea by the age of 4. If they're older than 4 and they never got the test, we quickly catch them up. And I'm going to go through what that test is. It's called a sleep study, or the fancy name is a polysomnogram. It's the only definitive way to test for sleep apnea, and the reason why I care so much is we now know even mild apnea in someone with Down syndrome could lead to a loss of 9 IQ points within a year. And we work so hard at their education and their IQ points. Why should we lose it to obstructive sleep apnea? We can stop it with effective treatment. So that effective treatment is either going to be going to surgery and getting the tonsils and adenoids out, or sometimes they need to wear a mask at night, like my sister does, in order to make sure the oxygen gets in. Take-home message, if you have a son or daughter with Down syndrome who's older than 4, and they've never had a sleep study, my recommendation is to get one. If they've already had a sleep study, they will need to go back and get another one if any of these symptoms start to reemerge. And the reason why this is under behavior is usually the first presentation is behavioral dysregulation, because they're not getting good oxygenated sleep. People with Down syndrome can also have some other conditions that go along with the show. We just don't say, oh, that's the way those kids are. Oh, that's Down syndrome. Maybe it's Down syndrome and ADHD, or attention deficit hyperactivity disorder. These are people with Down syndrome who have trouble paying attention or sitting still in more than 2 seconds. People with Down syndrome deserve the same medications that other people get. And with people with Down syndrome and ADHD, they can get better, they can learn faster when they get the right medicines diagnosed. Obsessive compulsive disorder is what my sister has. This is where she's so focused on one thing, she can't pay attention. So when she got her first job, she was so concerned that her purse wasn't being zipped up. So she kept on checking on her purse, she kept on checking on her purse. And then she wasn't doing her work. So ultimately, she couldn't bring her purse to work. And then she was worried about your purse, and your purse, and your purse. And then she got fired from her job because there was no amount of accommodations that they could do. She was always focused on her purse being zipped up. Until she got the medicines that she deserved to restore her to who she was and get rid of the obsessive compulsive disorder. People with Down syndrome are more prone to depression and anxiety. I had a patient of mine who came who was 12 years old and wasn't talking anymore. It was like this. Hey Carly, how are you doing? Who are some of your friends? What do you like to do for fun? And I asked Mom, so when's the last time she talked? And she said 7 years ago. I said, oh, well, what does she do all day? I don't know. I send her to school, they can't get any words out of her. She has no interest, she just doesn't talk, she's not herself anymore. So she's not constipated, we checked her thyroid, it's not obstructive sleep apnea, we're going through this, it takes a couple of visits. And I say, okay, well when she does say something, what does she say? And Mom says, well not much, every once in a while she'll mention my mother's name, her grandmother's name. And then I said, well did she talk? She said, yeah, up until about 8 years ago, she was a chatterbox, her speech was great. Then we started unpacking it and we realized she was thinking about Grandma's death, who died 7 years ago, as though it was yesterday. She was still stuck and depressed about Grandma passing away. Everyone was sad when Grandma died 7 years ago, but they were able to honor Grandma's legacy and bring her back and move on in life. We gave her a small dose of medication for depression. Within a month, she came back, she was talking again, she was learning again. She had depression. People with Down syndrome have major life events. So if someone dies, a brother or sister gets married and moves out of the house, there's a divorce in the family, you move. Some of these things in life we can control, some we can't control, but people with Down syndrome can be very prone to that. If they are, we can help them out with some medications. So depression and anxiety, we look for and have major changes. And this could really affect schooling and scholastics as well. This is a book I recommend if you have a teenager or an adult with Down syndrome. Mental Wellness in Adults with Down syndrome. Every chapter is a different mental health issue and how to treat it for people with Down syndrome. Autism spectrum disorder is another condition, and up to 18% of people with Down syndrome can develop autism spectrum disorder. If you have a son or daughter with Down syndrome who is nonverbal or has more communication skills difficulties than we would expect in someone with Down syndrome. If they have some repetitive behaviors, this could be hand flapping, this could be twirling, this could be doing objects. And you have a son or daughter with Down syndrome that prefers to be on their own and play on their own rather than playing with other children. If they have all three of those together, it might be more than just Down syndrome. It can be Down syndrome and autism. And why do I care? I don't care about another label, but I care because knowledge is power. And if we make another diagnosis, we can also ascribe other treatment protocols. There are behavioral recommendations, behavioral treatments for people with autism called applied behavioral analysis that works very well in people with Down syndrome. And there's other medical workups that your doctors could do to look for other reasons for autism. So in our clinic, we find other reasons and there's other medical issues that we need to follow. I want you to know if you have a son or daughter with Down syndrome and autism, you are not alone. When there's a whole book written about you, you know you're not alone. And this is the book that I highly recommend, When Down Syndrome and Autism Intersect, and you can get it through woodbinehouse.com. There's also an international support group online for parents who have children that have both of these diagnoses at the same time. I want to move on. We just did the first topic. You came to me in clinic, you said, I'm worried about behavior. Now the next thing you're worried about is weight. So let's go through weight. People with Down syndrome tend to be overweight and obese. The reason why is as they get older, the metabolism, the rate at which they burn the food slows down. In the United States, we have new growth charts for people with Down syndrome, but we know that the 50th percentile, the average person with Down syndrome is overweight. And we really want to make sure we focus on good nutrition because being overweight predisposes them to even more obstructive sleep apnea, to diabetes, to liver problems. And we can stave that off by making sure that they eat well. Body mass index, this is a combination of your height and weight. And I would say every year make sure you know your child, your son or daughter's body mass index. If it's at the 85th percentile or higher on the typical curves, then this means that they are clinically overweight and obese. At that point, I recommend doing some additional blood tests to make sure that they're not starting to develop diabetes or liver issues that go along with Down syndrome, even more so when they're overweight and obese. And I really recommend working closely with a dietitian because we could change that by really working on portion size and the amount of sugar consumption that people with Down syndrome take in. The next question I get is, I want my son or daughter to participate in lots of sports, but what do I need to be worried about? Isn't there something in the neck that I need to be worried about? So we know that the vertebra in our neck, the first one is numbered C1 and the next one is numbered C2. And we have this little process called the odontoid dens, which is hooked to the back with some ligaments. Your brain is up here and your spinal cord is caged between those two. So your vertebra is really the protective rib, if you will, for the spinal cord. People with Down syndrome, this ligament is too loosey-goosey sometimes, so that odontoid end starts to come forward, and if it starts to tap the spinal cord, that can lead to some neurological issues. In extreme cases, if it starts to really press on the spinal cord, it can lead to paralysis, where people with Down syndrome are not able to use their hands and their legs. Every year in the United States, we have one person with Down syndrome who has total paralysis, but it doesn't happen overnight. They usually have 8 to 9 months of warning signs that didn't go recognized. So it's really important to know what are the warning signs that a person with Down syndrome is starting to have. If you witness any of these or your son or daughter with Down syndrome, it's important to seek medical attention. If all of a sudden they're walking differently, if all of a sudden they're not using their arms or their hands like they used to, if they start to lose function of their bowel or bladder where they had it, if they have neck pain, neck stiffness, neck tilt, anything in the neck, if they have new weakness, or if they have big reflexes that were never there before, these could all be signs that the spinal cord is starting to be touched, and in these circumstances we need to go to the doctor to get an x-ray. And we need 3 views of the x-ray, one looking straight ahead, one looking down, and one looking up. And you need to have a great radiologist because they need to measure this little distance there, and it's in millimeters. If it's loosey-goosey by more than 4.5 millimeters, then we need to make sure that we're not putting them in any activities that might cause damage, further damage to their neck. In extreme cases, sometimes we have patients with Down syndrome that need to get surgery in order to bolt their vertebra or their neck together. To summarize again, if your son or daughter with Down syndrome is having no symptoms listed here, they can do whatever they want and they don't need x-rays. If they are having some symptoms at any point throughout their lifetime, they need to get an x-ray. If they get an x-ray and it's perfect, it just means it's perfect that day. They can develop this at any point throughout their life, and they might have to go back for multiple x-rays throughout their life. So just be aware of the warning signs. It's important to know that those x-rays don't predict which children are at risk. Some families say, I'm concerned my son or daughter is having some shaking movements. This could either be seizures or something else we're talking about. So seizures in people with Down syndrome present before 1 year of age or after 30 years of age. Between there, people with Down syndrome can have the typical seizures that a neurotypically developing child could have. But when they're less than 1, it could be infantile spasms. For those of you who have children who are less than about 15 months of age, I want to show you what an infantile spasm looks like. Let's see if it's working. It doesn't look like the videos are working on this particular laptop, so I'll demonstrate what they look like. This is a baby. When the baby starts to have an infantile spasm, they'll start to have some arm jerks. So if you see an arm flick that seems to be uncontrollable, that could be a seizure. Or a seizure in a baby can present as a forced smile or a grimace. So it's not just a smile, it's a smile where the sound stops and it looks like a frozen smile. Or a smile with an arm. If we start to see that, it's really important to get to a doctor really soon for them to do a study of the brain called an EEG. If there are seizures, we want to stop the seizures within 24 to 48 hours. If we are able to stop them with medication, then the person with Down syndrome will have little to no effects over the lifetime. If we're not able to stop it, then it means sometimes the brain wiring gets off, and these can be individuals with Down syndrome who sometimes don't speak or don't walk for the rest of their lifetime. So this is why we want to catch these seizures soon, and they occur in up to about 8% of babies with Down syndrome. So again, looking for a forced smile or an arm movement like this, right? I want to tell you a little bit about our Down syndrome program at Massachusetts General Hospital. We see people with Down syndrome of all ages, from little newborns all the way up to old age. When you come to see us in clinic, you'll see one of those doctors and you'll see 4 of these individuals. Amy is the person who puts together your whole day. She's our program coordinator. Chloe is our social worker to connect you with the books, the resources, talk to this parent, have you been to this conference? Ben, of course, is a person with Down syndrome. He's our resource specialist. We hired him and he's my longest serving employee. He greets you when you arrive, he puts you into the room, and he also has about 5 minutes with every patient to talk about a medical issue that's important to them. So if I make a diagnosis of obstructive sleep apnea, Ben wears a mask at night, so he talks to my patient on how you can wear a mask at night to help your oxygen levels. If you develop celiac disease, that's okay, because Ben has celiac disease, and he'll talk about gluten-free foods. If you want to date someone, Ben will tell you, oh, I've been dumped and now I have a new girlfriend, and this is what it's like to fall in love. If you want to move out of the house and live away from your mom or dad, Ben will talk about what it's like when he moved out of the house and has a place where he lives. So Ben really is a secret weapon and an important part of our medical care. And then we have a nutritionist, and we're in the process of hiring a new one to be a part of our clinic. Our clinic is broken down into 5 different groups. We have our prenatal clinic where pregnant couples can come if they want to learn more about Down syndrome while they're pregnant if they get a prenatal diagnosis. Our infant and toddler clinic is, rather than making 8 or 9 different visits to the hospital, we try to make it all happen on one day. So one day, you'll see the people that I just mentioned. In addition, you'll get your hearing tested, your eyes tested. You'll get an evaluation by one of our physical therapists, occupational therapists, and speech therapists. You'll see a dentist, and then you'll do a feeding therapist, all right? And all of this will go back to you and go back to your primary care doctor so that they can be up to date. When your child gets older, they graduate to the child clinic. We have all the same doctors here, but we also start to have psychologists and neuropsychologists so we can help you with the school issues that might arise. When they get older to the adolescent and young adult clinic, we again start to have some educational specialists that are embedded in the clinic because we believe that medicine and education are so entwined together. So we have communications with the school system and back and forth in order to advocate what are the needs that people with Down syndrome should be getting in school. If someone with Down syndrome isn't included in a typical classroom, then we'll make sure we send in Gretchen on behalf of our clinic to go in and advocate in the school to get that inclusion. And if that doesn't happen, then we have some lawyers on our team which will help happen and make it happen legally. We have an adult clinic. These are for individuals with Down syndrome 21 and older, those who start to develop Alzheimer's disease. We make sure that we're there for medication and support for their family, and we have a team of adult specialists here. I have to say that we're lucky and privileged to be able to provide this in the state of Massachusetts where I practice. My sister with Down syndrome, who is 38 years old, lives in another state in the United States called Ohio. She doesn't have access to any of this. And I would say 95% of people with Down syndrome living in the United States do not have access to a clinic like this. And around the world, we don't have enough clinics. And that's because these clinics don't make money and they aren't sustainable in the hospital system. So this clinic is run on philanthropy. So one thing I'm really excited to present to you for the first time is the fact that our team has been working for 1.5 years to decide how do we bring the lessons that we've been so privileged to learn in our clinic to families around the world. And so we have created for the first time a virtual Down syndrome clinic. So we received a grant from our government, and we built a virtual clinic called Down Syndrome Clinic to You, and you can go there by going to dsc2u.org. And I want to give you a tour of what this looks like. So when you get there, there will be a form to fill out, and there's 10 chapters to this form. And what we did is everyone I just showed you in my clinic, we've downloaded our brains. So any question we would ever ask you in person, we ask on this form. And to be honest with you, when you come to the doctors, we're trained to be pattern recognitions. So if you say, I have an 8-year-old with Down syndrome, they're snoring during the day, and they're having some behavioral problems, those 3 things in my brain say, oh, it might be obstructive sleep apnea. So what comes out of my mouth is we need to get a sleep study. Why can't I program the computer to do the same thing, right? So we have our psychologist download from their brain. We have my download from the brain. We have the nutritionist. We have the speech and language therapist. We all download it into the brain, and you answer these questions here. So the first thing is you put the date of birth, you put the name, male or female, and the computer has branching logic, so it's going to ask you different questions based on whether it's a female or male, what the age is. As you go throughout, here are all your concerns. So what are you concerned about? A new limp, a fever? Are you concerned about this? This is in this section here. We have sections on past medical history, on nutrition. We have questions about school, cognition, learning, any questions you ask there on life skills. The more you complete, the more you'll get back. The less you complete, the less important to you. Here you can see we're asking about blood work, what's been done this past year, so we're taking all of that in. When you get to the end of these 10 sections, you push submit, or what I call the magic button. And when you push submit, based on your responses, we have all of our algorithms, and you will get 2 personalized things in your inbox. One is you'll get a personalized checklist for you as parents based on your response, what we recommend. So here's the cover sheet, and this is just a snapshot of what it might look like. Okay, based on your responses, it looks like your son or daughter might have obsessive compulsive disorder. Click here to read just this chapter in this book, because this will tell you what you need to know. Why did we recommend that? Well, if you read here, we recommended it because you said your son or daughter is doing these things, right? We might recommend that they have to get a special vaccine. We might recommend, oh, it looks like they have this other bone condition that goes along with Down syndrome. We might give you other options on nutrition, so it looks like their calcium levels might be down. Here are some other things you want to teach your son or daughter, how they can describe how they're feeling. You want to teach your son or daughter how to provide personal information. They don't know the difference between a stranger and a friend. There's all free storybooks that we've created that you could click on for free to teach them about that. Then we have things on education. If you're concerned about they're struggling with math or they're struggling with reading. We've combed the US to find all the best books that are out there available, and we've linked them here. So we've really worked with all the experts in the Down syndrome community to make sure we're connecting to what you need, when you need it, in the moment you need it. Then you will also get a handout for the doctor, so that the same recommendations that we give to you in mom and dad language, we write in doctor language, so you can take it in, and they could go through and they could say, okay, here's what's being recommended. So you can work with your doctor to see whether or not you agree it's appropriate recommendations. And then the doctors give a list of all of the handouts and the recommendations that we've provided. This is the team that's created it, and I have to say, I can't be more thankful for having a talented staff to be able to put this together. Right now, we are testing it in the United States, and it's available to 200 families in the United States. Next year, in August of next year when we're done, hopefully our research will show that it's helpful and it's improved healthcare. After that, our goal really is to bring this to families around the globe. And if you think this could be helpful and if you think this could be interesting, we would love to be able to bring it to India, because as long as people have access to Wi-Fi, they should be able to have access to the same medical information no matter where you live. We also want to work with an international team of doctors to fuel this, to make sure as new information is being updated, you just have to go here and fill this out, and it doesn't matter where you live, whether you're my sister in Ohio or whether you live in Pune, India, you will get up-to-date information as we feed the system from year to year. All the sort of facts and information, if you want to learn more about infantile spasms, if you want to learn more about obstructive sleep apnea, all available to you for free. This is my clinic's website at massgeneral.org. And if you're interested in research, what's the latest on research, you can go here as well. I hope that we stay in touch, and we could do so through Facebook. This is my clinic's Facebook page where we update information about Down syndrome, and this is our Twitter page as well. And these are all my personal pages, and for those of you who stay in touch, I'm more than happy to be your friend in any of these connections here. Again, thank you so much for inviting me back to your second international conference here in India. It's a real pleasure to be with you. There is too much to do, too little time to do it, so let's do it together. We're truly a global community. Thank you very much.
Thank you, Doctor. Some of the issues which we need to do in the conference. So thank you very much for this. I hope all of you have understood the gist of what he said. The parent is the first doctor for the child with Down syndrome. You educate yourself, and then you identify those symptoms very early, go to the doctor and demand what you want, having the education which you have taken on the side, because all doctors may not have all the information all the time. Now here's a group of research specialists who have put together, very painstakingly put together a program. So it will be good to, and we will really look forward for the next year when this program will be rolled out to everyone. I'm sure that there's some uniformity, there's some standardization, and there's some direction and purpose in which we are going. So thank you very much for giving us an absolutely lovely lecture, especially at the beginning of the conference. I think this conference is made just by the lecture alone. Thank you.